Hello everyone, my name is Collin Osborne and I am currently in the process of completing my master's degree in classics not too far away at the University of Waterloo. I am excited to share with you today the results of my inquiry into ancient medicine concerning the transmission of medical theory and practice from ancient Greek sources to medieval Islamic scholarship. The practice of medicine is an ancient one and highly varied in both method and practice depending on the region of the world one finds themselves in. For example, we as North Americans take different approaches to medicine traditionally than Asian peoples do, as I am sure you are all familiar with the idea of Eastern and Western medical practices. Eastern practices approach healing from a more holistic stance with a view to bringing balance to the mind, body, and spirit as a whole entity, and is often associated with dietetics and herbal medicines to bring the body in balance. Western practices tend to address the disease and its symptoms first and foremost in an allopathic approach, aiming to treat the disease as a separate entity from the body and eliminate it with drugs, surgery, or other forms of what is called mainstream medicine. This dichotomy that exists to an extent today becomes blurred when the clock is wound back and the transmission of medical knowledge from the ancient Greek West to the medieval Islamic East is analyzed for continuity. I use East and West in the context that peoples living around the Mediterranean Sea had of the world at the time, as their sense of geography was much more localized than ours is today. My brief study on ancient Greek forms of medicine and their methods of transmission to Islamic scholarship will analyze various Greek and Islamic medical authors with an aim to define how medicine was studied by each culture from a methodological and practical standpoint, and how Greek methods of medicine were preserved in Islamic scholarship. I will begin with an examination of the origins of the Greek medical tradition, starting from pre-Socratic Milesian philosophers, as their theories are integral to the theories of the Hippocratic Corpus and the work of Galen. Both of these works are the foremost medical texts adopted by Islamic scholars such as Avicenna and Abu Bakr Muhammad ibn Zachariah al-Razi. These medical authors adopt the Greek methods of medicine that were passed down to them through the efforts of translators during the medieval period, and they will be taken into account as well. All of these different elements support my argument that Greek medicine persisted in Islamic scholarship because of its relative refinement and efficacy for the time that were due to a long history of development. To understand the body and what goes on within it, as well as the external effects on it, there is much importance on understanding what constitutes the makeup of a human being. This is a fairly existential question, but one that would have bearing on how medicine was performed in the ancient world over hundreds of years, from the Greek classical period that began in the 5th century BC to the Roman imperial period in the first few centuries AD. The forerunners of Greek scientific philosophy were known as the Pre-Socratics, and of particular interest to me are the philosophers hailing from Miletus and Ionia during the late 7th and early and middle 6th centuries BC. The theories of Thales, Anaximander, and Anaximenes concerning the makeup of objects lend themselves to early Greek medicine. These philosophers posited that everything was made up of one natural element, according to Thales and Anaximenes, or a combination of natural elements, according to Anaximander. All of their theories involved in some way natural elements of the world, such as water, fire, or air, because these elements were thought to be ubiquitous in all existing things. While these theories were not originally intended to apply to medicine, they did influence classical Greek medical theory, as can be seen in the Hippocratic Corpus. The Hippocratic Corpus is a collection of medical texts that were written and compiled during the 5th and 4th centuries BC, and is the earliest example from ancient Greece of medicine as a professional practice. Within this corpus, which includes works with different dating and authorship styles, pointing to contributions from multiple authors, there are works that deal with the theory of humors within the body, the effects of certain kinds of airs and waters on the constitution of the human body, and collections of case studies dealing with individuals and the physician's attempts to treat them. There are many more topics addressed in the corpus, but the two topics that were adopted almost wholesale in medieval Islamic scholarship are the sections on humors and case studies, which we will now dive into. The general consensus among ancient Greek physicians in the corpus was that there were multiple types of humors made up of hot, cold, wet, and dry temperaments. These humors were a type of bile, black or yellow, phlegm, and blood within the body. They affected the well-being of the patient and needed to be properly balanced to ensure good health. Phlegm and bile flow through the body, and excess of this is what was believed to be a cause for certain diseases, like in the text on the sacred disease within the Hippocratic Corpus. It was called sacred because the convulsions were believed to be caused by the gods as punishment, but the Hippocratic Corpus rejects this theory. The sacred disease is what we know today as seizures, and was stated to be caused by a blockage of passages resulting in excess phlegm that manifests in the violent convulsions one has during a seizure, according to Hippocrates. The tradition of the medical case study is also found in the Hippocratic Corpus, with the collection of works known as the Epidemics. These case-by-case physicians' notes following the progress of a patient through to death or recovery from different diseases afflicting them were recorded in various ways. Epidemics books 1 and 3 stylistically appear to be earlier than their counterparts in the other 5 books of the collection. This is due to their bare-bones approach to documenting illnesses that the physician who wrote them encountered, chiefly noting symptoms, the days they occurred, and the outcome of the illness. The accounts in Book 3 are told in a detached manner, with no interference from the physician, who simply notes the effects of the disease, including how it affects bodily function, and on what day since the onset of the illness these effects occur. Before this, there is a brief mention of who the person afflicted with the illness is, where they live, their occupation, and the events that led to their falling ill. Thus, with books 1 and 3 seeming to be earlier in style, the other books in the Epidemics build on them, elaborating on different points such as environmental factors or pathology. As we move forward in time from the Hippocratic Corpus to Galen, who is a very well-known name from antiquity due to his prolific medical works that are still known because of their longevity into the centuries beyond his lifetime. Although he was born in Pergamon under the Roman Empire, Galen had Greek roots and can be seen as the next major continuation of the practices and methods presented in the Hippocratic Corpus. Galen continued the Greek humoral medical theory that was put forward by Hippocrates, accepting it completely as a basis for medical treatment. The concept of the 4 humors within the body was thus carried on centuries after it was put forward in the corpus as sound medical knowledge. Along with this theory come treatment methods that still hold water in Western medical science today, such as treating illnesses with their opposite. I'm sure we've all used a cold cloth to help mitigate a high fever or applied ice to a bruised area. And while we do not still use the concept of humors, the idea of applying the opposite element to a remedy still applies. This is thanks to transmission from antiquity to the medieval period by Islamic scholars, such as I will show next in my presentation. Before departing from Galen, I would be remiss to not mention his work, The Art of Medicine, which is a seminal work based on how often it was used as a teaching tool throughout the centuries from late antiquity to the Renaissance. The Art of Medicine covers the fundamental aspects of the practice of medicine that Galen gathered together from the medical works that were available to him by the 2nd century AD. And this synthesis is the basis behind his widespread use as essentially the manual for how to perform medicine properly, from analysis of illness to theories and definitions to treatment. The beginning of the transplantation of Greek medical works and knowledge was carried out by Arabic translators eager to get their hands on manuscripts of any kind that could be found. Europe was only beginning to build itself in the early medieval period, and the only culture valuing knowledge whilst being close enough to project power over the former Roman Empire in the West, as well as a holder of the medical knowledge of antiquity, were the Arabians. Translators of Greek medicine existed all over the Arabic world who considered it their duty to put into Arabic the works of Hippocrates, Galen, and other physicians. Harun al-Rashid, the first Abbasid Caliph, and his son al-Mamun were patrons of Arab learning in the late 8th and early 9th centuries. Al-Mamun in particular was a prolific collector of valuable Greek manuscripts from any sources he could find, and with his collection he founded the Baghdad Library where it was stored. Al-Mamun established a school of translators in 832 AD called the Brit al-Hikmah, where important non-Islamic works were translated into Arabic. And a man by the name of Hunayn ibn Ishaq was of great importance in ensuring the survival of important sects of Greek medicine through to an Arabic translation. He translated the entire Hippocratic Corpus into Arabic, as well as the works of Galen, Oribasius, Paul of Aegina, and Dioscorides' Materia Medica. On top of this, he also contributed to the formulation of a scientific vocabulary in Arabic by coining new words or borrowing from words with Greek or Syriac roots, allowing future Arabic scholars to be able to read the great Greek works of medicine. It is important to remember that these texts were translated and available in Arabic after the immense work done by these translators, but they did not necessarily fit in with Islamic scholarship. The scholarship, or what was studied and written by Arabic scholars, included only a few authors on medicine, while the practice of medicine itself was seen as something outside of medical theory. Avicenna was one of the earliest sources that we can look to for the compilation of the Islamic medical and scientific tradition. His experience as a physician among other professions, such as a philosopher, placed him in a position to challenge the existing structure of Arabic scientific theory, albeit without much success in his lifetime. His work shows that there was conscious thought in Arabic scholarship to somehow mesh medicine in with fields like physics and metaphysics inherited from the Alexandrian compilers of Aristotle. This compilation divided philosophy, or the sciences collectively, into theoretical and practical. Theoretical philosophy subdivided further into physics, or the natural sciences, mathematics, and metaphysics, and practical philosophy divided into personal ethics, household management, or economics, and politics. And nowhere in these subdivisions is medicine to be found, creating space for thinkers such as Avicenna to attempt to rework the schema handed down to Islamic philosophy by late antiquity. Aristotle did write works on medicine, but they did not fall under his books on logic, from which the physics is the closest true science, as believed by Islamic scholars, to the medicine and theory of medicine. Avicenna created a separate subcategory of the physical sciences to try to include the sciences left out, and divided physical medicine in two, fundamental and corollary, placing medicine under corollary alongside astrology, physiognomy, dream interpretation, and more. In this way, medicine was loosely tied in with the theoretical science of physics, but was still mostly viewed and studied by Arabic philosophers and physicians as a derivative and practical science, not on the same level as other theoretical sciences. Avicenna came up with his own model of humors and temperaments based off the works of Galen and Hippocrates. His model stated that there were 4 types of humors, natural components of the world, and 4 kinds of natural temperaments, which are as follows. The humors are phlegm, yellow bile, black bile, and blood, as we have seen before, and the natural components are water, fire, earth, and air. And the temperaments are 4 combinations of hot, cold, damp, and dry. So that means we can combine cold and damp, hot and dry, cold and dry, and hot and damp. The principles that came out of Avicenna's humoral model, when applied to medicine, made up a large part of the reasoning behind scholarly models and the popular medicinal thinking of the world of Islam as well. Now, along with the humoral theoretical model, the other aspect of Greek medicine to be translated was the practice of the case study. Medieval Islamic physician Abu Bakr Muhammad ibn Zakaria al-Razi wrote a large body of case studies that draw from Greek case studies, and Hippocrates and Galen are believed to be chief influences on the case studies of al-Razi. Al-Razi's treatises contain the greatest number of clinical accounts amongst Islamic medical writings. Having served as both a court physician and chief physician of the hospital in the town of Rai that he was born in, and later in Baghdad, we know of almost 900 cases he personally treated or supervised that were recorded and compiled posthumously by one of his students. With such an extensive collection of cases, ample evidence exists of how he transplanted Greek didactic models into his own practice and which of these models mentioned earlier, either Hippocrates or Galen, he found of most use. The collection of cases are preserved in multiple manuscripts called Tayyarib, and are short reports focusing on the symptoms of the patient and the remedy given, noting also sex and age. These accounts deal with similar conditions that have slightly varying treatments to study which therapies address humoral imbalances, coupled with Al-Razi's inquiries into the condition of the patient to best determine the appropriate therapy aimed towards better diagnosis in the future. And this structure is akin to Epidemics 2, 4, and 5 in the brief style concerned with pathology as it manifests in real cases and their link to instruction in therapy. We can surmise from this that since the structure of the Tayyarib looks back to the structure of works in the Epidemics, that Hippocratic clinical case reports as a concept survived and evolved into a method usable in Islamic medical texts. A collection of Al-Razi's personal medical notes points more to an influence from Galen than the Hippocratic Corpus, and this collection is called the Kitab al-Hawi, or the Comprehensive Book on Medicine. It contains passages of authors from as far back as the Hippocratic Corpus to Islamic contemporaries regarding pathology and therapy. And within this collection are a group of 33 case studies with the title Illustrative Accounts of Patients and Our Own Clinical Histories, which Al-Razi intended to be read side by side with cases from the Hippocratic epidemics because of an assumed link between those cases and his unusual cases. And coming back to the link with Galen, he covered his case studies and narrated them in a similar fashion, but he was not given to the bragging that is typically attributed to Galen. Greek medicine, which is a tradition that was preceded by the ideas of the Ionian Pre-Socratics from the 7th and 6th centuries BC, was developed and refined through hundreds of years and multiple different schools of thought that sought the proper ways to cure people of disease. Of all the different sects to come out of the period of antiquity, those of the Hippocratic Corpus and Galen, along with some other authors that shared similar views like Aristotle, survived to be adopted and translated wholesale into Arabic for the study of Islamic scholars. Islamic physicians adopt the Greek ideas of humors needing to be in balance for the body to function properly, with the natural elements of the world being both within and without the body. Not only medical methodology was adopted, as I have shown in my presentation regarding the 4 humors and temperaments that affect health, but the medical practice of the case study as well. The physical works themselves survived thanks to the efforts of men like Harun al-Rashid and his son al-Mamun, who helped establish in the Islamic culture a tradition for the collection of knowledge in the form of Greek manuscripts and the creation of the library at Baghdad. Hunayn ibn Ishaq translated the entire Hippocratic corpus into Arabic, as well as the works of Galen, Oribasius, Paul of Aegina, and Dioscorides' Materia Medica, as I have mentioned earlier. And he paved the way for the likes of Avicenna to challenge the theoretical doctrine of his time using Greek methods of medicine, and Abu Bakr Muhammad ibn Zachariah al-Razi before him compiled a truly impressive amount of case studies. All of these factors, when combined, allowed Greek medicinal practices and methodology to persist into medieval Islamic scholarship over 1,000 years later and even beyond that, showing that the roots of medicine lie in the adoption and adaptation of previous paradigms to fit current knowledge. Thank you very much for listening.